Welcome to the COVID-19 media briefing. We'll now begin with Mayor Tory. Go ahead.
Well, thank you very much, Lavin, and good afternoon. We are continuing to make progress on getting people vaccinated, and our VaxGiving drive is continuing even today and through this week. More than 82.1% of eligible residents are now fully vaccinated, and 86.6% of eligible residents have had at least their first dose. I hope everyone had a safe and happy Thanksgiving. The VaxGiving campaign was underway through the weekend. I'm proud to report that a total of more than 4,200 COVID-19 vaccine doses were administered by the VaxGiving clinics and the city's immunization clinics between the period of October 6th and Thanksgiving Monday. I want to express my thanks on behalf of all of our team here at City Hall to everyone who stepped forward to get vaccinated, and in particular to those who weren't vaccinated before but did the right thing over the course of the Thanksgiving weekend and got vaccinated. And of course, I add my thanks as well to all the people, if you think about it, who had to work at all those different clinics from our health partners and from Toronto Public Health and all the different places that have come together to do such a great job at getting people vaccinated. To help to continue to get people the opportunity to get vaccinated, we are launching Shop and Vax 2.0 this coming weekend, the new and bigger effort in that regard using malls. 22 vaccination clinics will be operated at malls and shopping plazas across Toronto. These are accessible locations. People know where they are. They're easy to get to, and where we know people are already out and about and in many cases will happen by and make the decision to get vaccinated. This builds on the success of the first Shop and Vax campaign last month, where Team Toronto administered more than 1,000 vaccine doses at 5 mall clinics. I want to thank once again Toronto Public Health and city staff for working to pull this new Shop and Vax 2.0 campaign together so that we can continue to drive up vaccination rates in areas where we know people still need to get vaccinated. I also want to recognize the TTC as great partners with our health organizations in our Team Toronto vaccination efforts. Around 4,000 vaccination doses have been administered at TTC-hosted clinics, many of them being first doses, which is very important. Starting tomorrow until Friday, the TTC will be hosting a vaccination clinic at the Wilson Station. A vaccination clinic will also be open again at Victoria Park Station this Thursday and Friday. These clinics are being held in partnership with East Toronto Health Partners and with the Humber River Hospital, and we thank them for their continued good partnership with us throughout the pandemic. This is all part of our determination to make the vaccine easy and as accessible as possible for people right across the city. The COVID-19 vaccination, the vaccine itself, is safe and will help to protect you against the fourth wave and against the Delta variant. And it is about potentially saving your life, keeping safe and healthy the people who are near to you, whether they be people near to you at home, your loved ones, or whether it be people near to you at work or at school. And so we reiterate our plea that we've made over and over again, and we will have to keep doing it as we push the numbers up, which is to please get vaccinated as soon as possible. Over the course of the summer months, I provided updates on the successes of the city's VaxTO campaign, which was launched at the end of May to help connect Toronto residents with COVID-19 vaccination appointments and provide information to them. We launched a VaxTO information text line featuring 14 language navigation options, 12 translated City of Toronto microsites, a variety of multilingual, social, and digital advertising, a series of citywide and ward and language-specific town halls, and an established call center where live agents have been able to connect directly with residents with information about booking vaccination appointments. This was all part of an effort led by the city and by Toronto Public Health and with the leadership of Councillor Cressy, who will talk more about this today. But it continues to be very important for us, and it has been the subject as we move towards the 90% target to shift our efforts so that we can help all eligible first dose recipients now become fully vaccinated with their second dose. This is a very particular challenge for us, and that is because as of yesterday, 215,000 more people from Toronto, residents of Toronto, needed to be vaccinated to reach the 90% coverage with both doses in the eligible population. But if you drill down on those numbers a little bit, you find that 123,000, a little more than half of those people have already received their first dose, and 48,000 plus are already considered overdue for their second dose. And so we will continue to work hard at that. Younger adults in the 18 to 24 and 25 to 29 age group represent the highest rate of partially vaccinated individuals, 1 dose but not 2. And so they will be working on them as many are overdue for their second dose. It's worth noting that in the last week, approximately 1,800 Toronto residents who were overdue received their second dose, but we still have a lot more work to do. But it does prove the value in the efforts we're undertaking, because 1,800 people did come off that list of first but not second dose and become on the list who are fully vaccinated. The VaxTO campaign will employ highly targeted text messages, broadcast voice messages, live calling through the call center in an effort to inform, to comfort, to remove any remaining barriers in terms of accessibility, location of clinics or the works to get those people to go and get vaccinated. And this includes using live agents to connect directly with people who are in this category wherever we possibly can, and tackle, by doing so, a variety of vaccine hesitancy and other information requirements that people have. So far, the VaxTO campaign has made steady progress, helping connect thousands of residents with COVID-19 vaccination information and resources. And this, just to give you a bit of a taste of that, 1.3 million interactive voice broadcast messages have been sent across the city in 7 different languages. 40,000 phone calls have been made directly to residents through the campaign call center. 17,000 messages have been received from the text helpline, so that's people asking us for help, which we've been then able to provide them with. And 10 telephone town halls have been held, ranging from citywide ones, with which both Dr. Davila and Councillor Cressy and Chief Pegg and myself participated in, to much more specific ward by ward, neighborhood by neighborhood, language group by language group town halls. 100,000 people have attended these virtual discussions, so that we are leaving no stone unturned, and we will continue not to leave any stones unturned. This campaign is helping to get people to have their first dose, and it is now focused as well on making sure we get people who have had that first dose to have their second dose. And I believe it shows that this team, here represented today by the 3 of us, but representing many thousands of people, will not give up and will not relent until we have reached people and convinced them to get vaccinated. I want to acknowledge one other sign of progress in our drive to have the city return to as close to a normal state as we possibly could before the pandemic began. And that is that starting this Sunday, the Toronto Public Library System, of which we're so proud, and they've played such a great role as well during the pandemic, including their staff and others helping with food security programs and a host of other things, they will be once again opening their branches with Sunday hours for the first time since March of 2020. A total of 58 library branches will be open this Sunday from 1:30 until 5 p.m. These 8 branches are the ones that will be open Sunday for the first time in a long time. Amesbury Park, Black Creek, Bendale, Cliffcrest, Evelyn Gregory, Northern Elms, Victoria Village, and Woodview Park. And these Sunday hours have been approved in our budget, because all of this does require, of course, for our professional staff to be paid. And it was originally approved in the 2020 budget, but of course the pandemic came upon us. It was to start in September 2020, but all libraries were closed to walk-ins because of the pandemic. And so I'm glad to see the libraries returning to more normal hours of operation, including Sundays, and more of our libraries than ever before will be open on Sundays as a result of a commitment your city government made to make sure that that happened. I'm sure that many people saw this weekend, when they were able to gather safely with their family and friends for Thanksgiving, that we have made progress. It was something we weren't able to do last year because we didn't yet have the vaccines. It seems like a long time ago, and it seems like the vaccines have been with us for a long time, but it's actually a relatively short time. These are good signs of progress. We have to address some of the things with a further plan, some of it coming from the province, with regard to making sure that we can continue on a responsible and gradual program of reopen and consistent policy. But we just need to make sure, more so than anything else, that more and more and more and more people get vaccinated, because we've got to get to that 90% level. That is the best insurance we have against slipping backwards and going back to days we would all just as soon not remember at all. And that's accompanied by other public health precautions people continue to take, with masks and other such things. So on that note, I would ask Dr. Davila, our Chief Medical Officer of Health for the city, to offer her remarks for today.
Thank you, Mr. Mayor, and good afternoon. Later this afternoon, Toronto Public Health will update its vaccination dashboard, capturing the latest on first and second vaccine doses administered in Toronto over the Thanksgiving long weekend. As you've just heard from the Mayor, as of October 11th, 86.6% of Toronto's eligible population has received one dose of vaccine, and 82.1% has received 2 doses. I'm grateful to the people of Toronto for the effort they have made to ensure that they, their friends, and their loved ones are protected from the worst effects of COVID-19 by being fully vaccinated. I want to remind us all that this is the largest vaccination campaign in history, and a campaign that we are working on 7 days a week in the largest city in Canada and the 4th largest city in North America. The vaccination campaign began in Toronto in December 2020, just over 10 months ago, with doses being administered by Toronto's hospital partners to frontline hospital workers and individuals in long-term care. The first city-run immunization clinics opened in March 2021, and in 8 short months, Team Toronto has delivered 4,801,730 doses and managed to reach Torontonians not once, but twice to ensure Toronto gets fully vaccinated. This is truly exceptional. And one may ask, how did we do this? Well, first, by leveraging data, bringing vaccines to every Toronto resident in every corner of the city as quickly as possible and with an equity lens. We've partnered with you, members of the media, to ensure that factual and timely information was communicated to members of the public. We've door-knocked and partnered with hundreds of community, hospital, and healthcare organizations. We've made calls, sent texts, and held town halls to answer questions. We brought clinics to workplaces, arenas, shelters, libraries, subway stops, drop-in centers, and retirement communities, to the front doors of where people live and to the neighborhoods in which people work. We are not only continuing to do this work, but we're doubling down on what we know works while continuously monitoring uptake and adjusting our strategies. This work by Toronto Public Health and our partners is being done in the context of a global pandemic, while people are experiencing a full range of emotions: fear, anxiety, frustration, grief, boredom, and isolation, amongst many others. This work is being done as well as Toronto Public Health continues to limit the spread of COVID-19, to investigate cases and contacts, and continue other critical public health programs. I think it's important to remember our unique Toronto context. Toronto is a vibrant, world-class metropolitan city, often cited as the most diverse city in the world, with nearly half of its population born outside of Canada, over 200 ethnic groups present, and over 140 languages spoken. Toronto's population also moves, grows, and shifts through immigration, student influx, and outflow, population migration for employment, and a variety of other factors. This is what makes Toronto thrive, and what makes our city so special. This reality also makes our task in relation to this immunization campaign, the largest in our history, more complex. And we are meeting the challenge by creating trusting relationships and mobilizing at the local level. When you compare Toronto to other similar metropolitan centers, you can see that we are indeed succeeding in our vaccination efforts. For example, as of Friday, October the 8th, compared to New York City, Chicago, and London, England, Toronto's entire population has the highest fully vaccinated rate. Still, what can we do to drive our vaccination rate even higher? I can tell you that Toronto Public Health, along with our various partners, are going to continue to do all we can to bring vaccines to every corner of our city. And you have a role too. Every member of the public, whether fully vaccinated, partially vaccinated, or still deciding, has a spot on Team Toronto. Today, aside from rolling up your sleeves, let me offer two different ways to support the citywide vaccination efforts. First, if you are a member or part of an organization, whether it's a workplace, a faith group, or a sporting organization, there are resources on our website which you can use to help support develop vaccination policy and to promote vaccination uptake. Also, I would ask that you please reach out to us at Toronto Public Health to express an interest in hosting vaccination clinics. Second, if you are a Toronto resident who received your vaccination outside of Ontario, please ensure that it is captured in the provincial system by Toronto Public Health. Again, there is a form on our website, toronto.ca/COVID-19, to help you with this process. This vaccination campaign is a huge undertaking, and our whole city is rising to the task at hand. We will continue to do everything in our power and use every tool at our disposal to increase vaccination amongst all those who are eligible. We know that vaccination is the key to putting this pandemic behind us. This holds true for protecting our schools. As you will likely have heard, Toronto Public Health has recommended that all students be dismissed from in-person classes and activities at Silverthorne Collegiate Institute as of this morning. This is the first whole school dismissal in Toronto for the current 2021-22 school year. In the course of our investigation, we found that there are currently 11 confirmed COVID-19 cases at school, 9 of which are linked to student-to-student transmission. All the cases are currently in the student population, and several of these cases were newly reported over the weekend. We have also found that there was potential transmission at multi-grade events, activities, and social gatherings inside and outside of the school. To limit any additional exposures, whole school testing has been recommended and arranged, and we will continue to investigate and make recommendations to return to in-person classes and activities as soon as possible. In addition, as we know that current vaccine coverage for eligible youth in this particular community sits at around 70 to 75%, we are ensuring that mobile vaccination clinic opportunities are available to students, staff, school administration, and their families this week. Vaccination, along with measures of personal protection, are the best tools at our disposal to protect ourselves, our families, our communities, and our thriving city. And with that, I'll now turn it over to Councillor Cressy to deliver his remarks.
Well, thank you, Mayor Tory and Dr. Davila. Today, I'd like to tell you a little bit more about the next phase of our VaxTO campaign that the Mayor outlined, specifically how it will help us to reach our 90% vaccination target. Now, since day one, we've been committed to bringing vaccines to everyone, everywhere. And across our city, people have stepped up. Almost 5 million vaccine doses have now been administered, and we're down to only 215,000 people left in order to reach our 90% fully vaccinated target. In Toronto's vaccination campaign, millions are now done, and thousands are left to go. Now, these numbers make us a world leader when it comes to vaccination rates. As Dr. Davila noted, when you look at other major world cities, Toronto is now leading the way. But we're not done yet. And that's where the next phase of our VaxTO campaign comes in. As the Mayor mentioned, there are 123,000 people who have had their first dose and are now eligible for their second, 123,000 people, including 48,200 people who are overdue for that second shot. So to be clear, these are residents who have already had their first dose. We know who they are, and we're able to contact them directly. Reaching them is critical to achieving 90%. So that's where VaxTO comes in. This phase is all about second dose conversion. Now, over the past 6 months of our VaxTO campaign, we've learned a lot. And one of the key messages is that for many people, it's access, not opposition, that delays vaccination. And that can be especially true for people who have had their first shot but not their second. So that's why in this phase, we're focused on connecting directly with those 123,000 people who are eligible for their second dose. And we're breaking down every barrier and building every bridge to get them that second shot, that second dose conversion, and it's the critical work underway right now. And by focusing on this core group, we can use really targeted tools to connect directly with them. So starting this week, this work includes second dose conversion live calling through our VaxTO call center. It uses text messages and it builds on broadcast voicemails. It's based on direct contact, having direct conversations that answer questions, that address accessibility, and tackle hesitancy. I like to think about it as it's kind of like a reminder for your upcoming dentist or doctor's appointment. Only in this case, not only are we reminding you about your second dose, we're also identifying any barriers you may have. Do you need a ride to a clinic? Do you need childcare while you go to get the shot? Do you need to have a conversation with a public health nurse to answer questions or alleviate concerns? And over the last 6 months, the VaxTO engagement approach has worked. And it's made one thing crystal clear. When we build connections with people, when we have real conversations and develop that trust, that's when we succeed. And that's what our second dose conversion push through VaxTO is all about. And so in the city, listen, we've come so far. This is in many ways the home stretch. So we just have to keep working and keep pushing. And as the mayor said, do everything we can to get our city vaccinated. With that, I'll turn it over to Lavin and we can open it up for questions.
Thank you. Thank you, Councillor Cressy, Mayor John Tory, and Dr. Davila. We will now open the floor to questions. As a reminder, it's one question, one follow-up, and we can unmute you when we call your name. So first up, we have Shauna Hunt from City News. Go ahead, Shauna.
Hello there. My first question is for Dr. Davila, and it's regarding capacity changes. So good afternoon, first of all, and thanks for having me. So the first concert back to Scotiabank Arena was on Thursday. The venue at that point was still, only half full. And video shows, that there was very little masking going on. People were standing shoulder to shoulder, singing at the top of their lungs. Some who were there tell us that there was just no enforcement on policies such as masking or social distancing. So first off, Dr. Davila, how important are these health measures in big settings like this? And how involved will Toronto Public Health be when it comes to enforcement? Will there be inspectors at these venues? Could the venues be fined if they're found that they're not enforcing rules? Can individuals be fined?
Well, Shauna, there's a lot of questions, I think, all wrapped into one there. So let me try to address the most major, the key points that you're articulating or seeking to get at. First and foremost, as I understand it, this is a venue in which, there is an established vaccination policy. So certainly having access only for those who are fully vaccinated goes a long way towards reducing risk. And certainly other measures, as we have seen throughout the course of the pandemic, will help to reduce the risk even further. Things like wearing your mask, things like making sure that if you are symptomatic, that you elect not to attend the event, and certainly maintaining physical distancing as much as is possible is another measure that can be taken to reduce the risk. And thus far, over the course of the pandemic, we've seen Torontonians really step up into that. We're seeing more and more Torontonians step into vaccination. And we've certainly seen over the course of the past, 18 plus months now that, people are wearing their masks and maintaining physical distancing. And that's why we've had the progress that we've had to date. So to my mind, as much as possible, to the extent that we can continue those good practices, this is the best thing we can do to put the pandemic behind us and to get back to enjoying concerts and all the other things that make life in our city so enjoyable and so rich.
May I just comment on that for a moment and say something quite directly? we've been talking about this from the beginning of the pandemic, that with the residents of the city of Toronto who've been terrific when it came to taking their personal responsibility to get vaccinated, for example, and to following rules that have evolved over time as we've gone through this very long, nightmarish pandemic. But there continues to be, first and foremost, a sense of personal responsibility people have to have so that we don't go back to a time of no concerts, no restaurants, no shopping. But I would also say that the places that have been subject to more liberalized rules were well aware of the fact that there were requirements that went with that. And there are requirements that are part of the regulations, but there are also requirements that I think have to do with corporate responsibility, whether it's big corporations or small corporations, to make sure that people are kept safe. And so that I just think that we have to look forward to future events of any kind, and to have the help. Sure, I mean, we can enforce the law, but there's only so many people we have to do that. We've said that from day one. When you're dealing with a city with millions of people and thousands of venues and all kinds of events going on. And so we hope that that combined sense of personal and corporate responsibility, together with the efforts that we will make to enforce the law, are going to be such that we will not go backwards. We will stay in a life that we prefer, I'm sure, to what we experienced a few months ago. But that's going to require a lot of cooperation, including some enforcement on our part, but more so, even more so, the cooperation of people and businesses to do what they know is the right thing.
Okay, quick follow-up, and Mayor Tory, you can react to this. I'd love to get your take on why restaurants and gyms are, why you think that they were left out of these capacity changes, and do you agree with it?
I think what I know is that there's a need for, and I know there's being worked on now, a sort of broader and more encompassing plan for kind of further steps in the reopening, the continued reopening of the city in a safe way that keeps people healthy. And I think we'll see elements of that that make sure there are consistent standards across the board for all sectors of the economy, and that inconsistencies that might be present at the moment are eliminated to the greatest extent possible in a way that maintains public confidence and that is easily understood by the public and by the businesses who are affected. So I think we're in an evolutionary state where things are changing, and I expect to see further changes, and have been in discussions about some of that work that has to be done.
Thank you, Shauna. Next up, we have Chris Glover from CBC. Go ahead.
Oh, hi there, guys. Thanks for taking our questions. Dr. Davila, this is for you. I want to go back to the Silverthorne collegiate story, if we could. There are around 20 other TDSB schools in active outbreak. And for example, a school in Scarborough has also got 7 cases right now, but every other school remains open. How come?
Well, Chris, I think that whether a school remains open or stays closed is really an assessment on what's actually happening on the ground. I think we all recognize, along with our school board partners and our healthcare partners, that as much as possible, we would like to maintain that in-person learning environment because we know how beneficial it is for our students. That being said, this needs to be done in a manner that preserves the safety of the entire school community. So absolutely, with the situation at Silverthorne, the investigation was such that it was determined that the best thing to do in order to limit ongoing spread and to ensure the safety of the entire learning community, that a whole school dismissal was warranted. It is the first out of 1,200 schools here, roughly, in the city of Toronto, not the first in the province. This is the nature of being in the midst of a school year in the context of a global pandemic. But certainly we are working with our school partners, with our healthcare partners, to make sure that every tool at our disposal is being used to help speed forward that investigation. And we are really looking forward to having that work pan out such that we get people back to that in-person learning environment as soon as we can, in a manner that's consistent with safety. So can't emphasize enough: vaccination, ongoing public health measures. These are the kinds of things that will help restore that community back to in-person learning as soon as possible.
Okay, thank you for that. Now, according to a memo from Shelter Support and Housing Administration, the city estimates that only 49% of people staying at shelters are fully vaccinated. Toronto Public Health is urging homelessness service providers to call the unit to book a mobile clinic, but the advocates that we're talking to say that this approach is too passive. So what is the city doing to increase the vaccination rate at homeless shelters? And is vaccination at shelters going to be made a priority? Why or why not?
So, Chris, I can tell you that it's been months now that vaccination at our shelters has been a priority, certainly for us at Toronto Public Health, recognizing that within settings where you have people gathered together, those are the conditions that give rise to potential transmission risk when it comes to a disease like COVID-19. So certainly it's been a priority for us, as I know it has been a priority for our colleagues at the Shelter Support and Housing Administration who are overseeing the shelter system in the city. And certainly it's a priority for shelter providers. So what's interesting, of course, is that the shelter population isn't a static one. It's one that's constantly changing. So this means that as a series of both shelter providers and those of us in public health, along with our healthcare providers who are vaccine administrators, we're constantly going back and talking over and over again and making clinical opportunities for vaccine available on a regular and ongoing basis, because the population's constantly changing. So again, very difficult to pin a very specific number because you do get some fluctuations and changes in the population over time, but that doesn't stop us. We are in every possible venue, shelters, drop-ins, to say nothing of our fixed sites and sites that are available in pharmacies and other primary care practices as well, to make sure that everybody who is either a shelter provider, shelter staff, or a client of a shelter has access as much as we can provide to vaccine in order to protect them and those around them.
Thank you. Next up, we have Francine from the Star. Go ahead, Francine.
Oh, hi. My question is for Dr. Davila. How likely do you think it is that other schools will be forced to close? And do you have any estimates as to how many may be forced to close in the coming weeks?
Francine, that's a good question. The challenge, of course, is it's always difficult to make predictions, especially about the future. I believe that's how the saying goes. What I can tell you is that there is no question, whether we're talking about schools, school boards, us at Toronto Public Health, our healthcare partners who are engaged with us in ensuring as safe a school environment as is possible. We would like to see the continuation of in-person learning to the greatest extent possible, but it has to be done in a manner that preserves the safety of those who are part and parcel of that school community. So of course, this refers to students, but it refers as well to staff within the school environment and the families of those people who are part and parcel of those school communities. We have over 100 nurses who are working with schools. They have many measures that they've got in place at schools in keeping with provincial guidance, whether it's screening tools that are done on a regular basis or the use of daily screening, guidance on masking, guidance on infection prevention and control, and reporting mechanisms so that we can identify cases as quickly as possible and put in all the necessary investigative and control measures to limit spread. So we are doing our utmost to reduce the likelihood of any kind of transmission or the presentation of COVID-19 in schools, and hopefully to reduce the need for any kind of school dismissal or closure, as was the case in one school out of 1,200 for the first time in this school year so far in Toronto. I know that schools elsewhere in the province have had to do this as well, but I can assure you that we are all working our very, very best to make sure that we're keeping those to a minimum. And when they do occur, that we're trying to keep them as brief as possible while at the same time ensuring a safe school environment.
And my second question is also for you, Dr. Davila. Where does public health stand with plans to vaccinate children? Where are you at with that?
So we have actually been working for many weeks with our healthcare partners on ensuring that plans are available and ready to go. The main component here is to ensure that there actually is a product available that's licensed for use in a younger population, those in our community younger than 12. And as our goal has been, knowing that this product was coming down the pipes, our goal has been to be ready for when Health Canada has reviewed an application made by the appropriate manufacturers. And once we have a licensed product, we want to be ready to ensure that people have avenues and channels that make sense to their particular circumstances to get their children vaccinated and to afford them the benefit, the protective benefit of vaccines as soon as possible.
Next up we have Mike from CTV. Go ahead, Mike.
Good afternoon, and thank you for taking my question. This is for Dr. Davila, following up on Silverthorne as well. Just hoping if you can confirm how many of those 11 student cases were transmitted at the school, and secondly, can you elaborate on a specific event or setting at the school that you may be looking at that led to the spread of the virus?
So thanks for the question. What I know is that at this point in time, of the 11 cases that we had confirmed, 9 were related to student transmission. And I don't have all the specifics around all the different events, but I do know that there were a number of different multi-grade activities and events both inside and outside of school that were found in the course of our investigation that certainly represented opportunities for transmission. So, you know, these kinds of investigations do take time, but I can assure you that all the measures have been put into place, and we are looking forward to trying to get these kids back to school as soon as possible, recognizing that they've got whole school testing now, online learning ongoing right now, but we're looking forward to seeing them get back to school in person as soon as we can, as our investigation proceeds and establishes that it's safe for them to return to an in-person learning environment.
Thank you. And just my follow-up, we heard from the TDSB earlier today that the vaccination rate at the school is about approximately 75%. Any of these cases include students who are vaccinated, whether it's one or both doses?
So, you know, I'm sorry, I don't have that information in front of me, but you're quite right that in this particular community within which the school is located, that eligible youth vaccination coverage rate is now sitting at 70 to 75%. And that's unfortunately below that which we're seeing overall for the city in this age group. So that's why we're out there with our healthcare partners, ensuring that vaccination clinics are available to those students, to their families, and to staff and families at the school to try to bring that rate up. We know how significant the protective benefit of vaccines is in reducing transmission of COVID-19, along with the other protective measures and infection prevention and control measures. It's that combination of all these things put together that will allow us to restore that in-person learning environment as soon as is possible.
Next up, we have Mark from 680 News. Go ahead, Mark.
Thanks, Lavin. Hi, everybody. Question to Dr. Davila, just to carry on with the Silverthorne questions while we're on the topic. Public health is responsible for closures at the schools after an outbreak has occurred, but it's the province's responsibility for the safety measures to prevent the outbreaks before they happen. I'm wondering if, in your opinion, Dr. Davila, should Toronto Public Health take over more direct control of the preventative measures in the schools in Toronto?
So, Mark, I can tell you that the team at Toronto Public Health that is engaged with our schools is deeply embedded and in regular conversation, not only with schools and school boards, but certainly with provincial partners as well. And this work occurs all over the province. We are all learning from each other, you know, what works in different settings, and we're constantly improving those infection prevention and control measures in concert with our expanding knowledge on this still relatively novel virus. So I'm quite satisfied with the way things are working, and we're continuing to learn, and you'll see us obviously always improving our practice based on our experiences on the ground and learning from the experiences of others as well.
Follow-up then to either Dr. Davila or Councillor Cressy. Does the change in the VaxTO focus to second dose conversion calls and texts mean there will be no more calls and texts about first doses, or will that aspect of the program still continue, but just in sort of in a back burner kind of way?
So perhaps I can start off and we'll see whether Councillor Cressy has anything further to add. I think, Mark, the short answer is that we are turning over every imaginable rock. So certainly with VaxTO, there is an emphasis at this point in time in getting second doses to those who we clearly know already have a first dose on board. But that certainly doesn't deter us from seeking to increase first dose administrations for those who have yet to take advantage of the protective benefit of vaccines. We know that this is one of the most valuable tools we have in our toolkit to help us get to the other side of this pandemic. And I don't think there's any question that all of us want to, see this pandemic more in the rearview mirror. And we know that vaccination is a significant step towards getting us there sooner rather than later.
Mark, the only thing I would add is I think since the very first day of this vaccination campaign at the city, our approach has been multi-pronged. Use every tool in the toolbox, open every type of clinic, use every form of outreach available, and communicate to everybody in every language. And so this next extension of VaxTO to really drill down and focus on those 123,000 people who are eligible for their second dose, that's in addition to all the other work that's ongoing and outstanding to reach people to get their first dose. And so we're just not going to stop. We're going to continue to expand until we hit our vaccination target.
Next up,
Just to say, in very short form, we don't have a stove that has any back burners. They're all front burners, and it just means we have to apply more resources and more determination to get this job done. And we shift priorities from time to time, but there are no back burners on our stove to get this vaccination done.
Next up, we have Mark from City News. Go ahead.
Good afternoon. A question for Mayor Tory, unrelated to everything that's been spoken about today. But you've got a homeless advocacy group that has come forward today with a 60-page report and suggestions over what to do for those living on the streets this winter, saying that the city's plans in previous winters have been inadequate. So they're calling for more non-congregate shelter beds in the system, extending the hotel leases that have currently been put in place. Just curious to know what your thoughts are in terms of them saying that it hasn't been enough in previous winters.
Well, I think, the best thing probably to do is to wait until the winter shelter plan is actually out there. And then you'll see that on things, some of which you mentioned, including extension of leases and so on, that activity has already been undertaken by a very hardworking and very diligent city staff. So I'll read the report. I haven't yet had a copy of it provided to me, but I'll read it, or it may be in my office and I just haven't seen it. And we're willing to take any reasonable, steps that are necessary. But oftentimes it seems that, we read about these things in the newspaper as opposed to having a genuine sense of collaboration with some of these groups. But I don't know exactly who wrote this report, but some of them, are more interested in political theater than they are in actually helping us with this issue. But we're going to take every step we can to protect people, as we have in previous winters, and we'll do everything that we possibly can to help people experiencing homelessness, especially in our very harsh climate.
As a quick follow-up, the group known as the Shelter Housing Justice Network is the one that put it together. And in addition to that, some of their key demands include, obviously there's been some contention around the homeless encampment clearings. Among the demands, repealing the no camping bylaw and freezing all evictions from the homeless encampments. Obviously, we've spoken about this quite a bit, but just wanted to get your thoughts on the fact that they're once again calling for that.
Encampments in public parks remain unsafe, principally. Hundreds of calls to fires and other kinds of emergencies. They're unhealthy. They just can't possibly be healthy with the sort of food, with the sanitation and other kinds of situations, and they're illegal. And I would be shocked if the City Council of the City of Toronto were to overturn a bylaw that provides for those kinds of encampments not to be a proper legal use of public parks. I personally would not support that, and I think the vast majority of City Council would not support that. What we're going to continue to do is to work really hard, as we're doing, city staff and other people we brought in to try and help us with this from the community, to take the people experiencing homelessness and one by one, which is how we have to do this work, convince them to accept safer indoor housing, healthier indoor housing, and to hope that maybe some of the encampment people who actually are continuing to set up tents in parks that sometimes aren't even for homeless people and things like that will decide that they're going to get on board and help us with our efforts, including the efforts we're making with supportive housing, where I've had no help from that group or those groups whatsoever. But we'll continue with our efforts, but we will not be, at least not under my leadership. I very much doubt that City Council would ever overturn a bylaw that prevents public parks from remaining as public parks for all of the public to use, and not as places that are unsafe for housing purposes or for residential purposes.
Next up, we have Stella from Radio Canada. Go ahead.
Hi, my question is for Dr. Davila. I have a quite technical question. I wanted to know why previously positive individuals are often grouped with fully vaccinated people in the guidance regarding, for example, self-isolation. Is it because they are considered sufficiently immune?
So sorry, Stella, I'm not sure I understand the entire context of your question, but perhaps because it is of a technical nature, I'm happy to discuss with you offline to make sure that I understand the full context of your question and to get you your full answer.
Perfect. Yeah, okay. If it's a possibility, let's do that.
Okay, follow up, Stella?
Yeah, maybe it's clear if I ask it this way, because I was wondering if I could have more info about the category named as previously positive person and how public health came up with a definition, because it's people who their initial positive result was 90 days ago or less. And I was wondering, how did you come up with, or how public health came up with 90 days or less? Is it because of the research surrounding immunity?
So again, Stella, I do think it would be helpful to have a look at the document that you're speaking of. I would be very happy to confer with you offline, understand which document it is, and see whether in fact the question is appropriately directed towards us, or whether in fact we're talking about provincial guidance. But happy to understand the very specifics of your question and get you an answer that makes sense.
Okay, next up we have Nigel Hunt from CBC. Go ahead.
Yes, hi, this is for Dr. Davila as well. You were talking earlier in terms of the vaccination campaign to use every tool, and I know you've spoken before about in support of a mandate for vaccination of students. Now, we just saw a large high school closing due to an outbreak. So what does that say, or how does that impact what you're going to do about the need for a vaccine mandate among students?
Well, I think the students are actually a reflection of our broader community. And as we've seen in our broader community, there is a clear and distinct benefit to greater and greater vaccination coverage in terms of protecting not only those who are vaccinated, but everyone around them. So there's no question that vaccination remains a very important tool in our toolbox. And as you've just heard the mayor and Councillor Cressy speak to in answers to other questions, we have every imaginable resource being put towards increasing vaccination coverage. It is an absolute front burner issue for which there is no back burner, as you heard the mayor say. So as far as I'm concerned, we are making every opportunity for vaccination available to people in the community, in keeping with the data as we see it, where vaccination coverage needs to be higher. When it comes to that which is happening within the school communities, I would suggest to you that vaccination policy, particularly in the education environment where it does fall to provincial, under provincial jurisdiction, is probably best to occur at the provincial level. Hence, those have been the kinds of conversations we've been having, I should say, with provincial counterparts when it comes to vaccine policy in schools. But certainly, as far as we're concerned, what we can do here at the local level is to use every bit of knowledge we've learned over the course of the pandemic to make vaccines as readily accessible and as easy to get for everybody who is eligible to receive vaccine.
Yeah, I just have a follow-up to that. We saw at the local level, for instance, the TDSB had put in a mandate to have their staff vaccinated. So are you saying that you cannot, or that you just don't support at the local level having a mandate to vaccinate students, or you have to wait for the province? Could you just clarify that, please?
So I would say that given that we're talking about the education system that is within provincial purview and that the province actually has the records and has the jurisdiction, they are probably the more effective party for vaccination policy of this ilk. That being said, what we can do at the local level, as I've mentioned, is to make vaccination as easy as possible for everybody who is eligible, to make sure that people actually have opportunities to get their questions addressed when it comes to vaccination, and to ensure that people really do understand that they have the information they need. They know where to get vaccines, what the benefits are, and why they should go out and get it, and recognize that it's not only for themselves, but for all of us who wish to see in-person learning continue, particularly because we have those who are less than 12 years of age who are not yet eligible to receive vaccine. The best thing we can do to continue to preserve that in-person learning environment is for all of us who are currently eligible to receive vaccine to get vaccinated.
And lastly, we have Jane Stevenson from The Sun. Jane, go ahead.
Thanks very much. I'm just wondering if the mayor and if the doctor or the council want to weigh in as well on this development by the Toronto Transit Commission considering recalling retired workers to fill gaps caused by workers who do not comply with the COVID-19 vaccine mandate by the end of the month.
Well, I'll perhaps start and simply say this. When you have a situation that arises either because of a work disruption or in this case possible, and I certainly hope we don't have any kind of widespread or hopefully any people that get suspended, for example, or anything like that because of failure to adhere to vaccination policy, you have to have contingency plans. We've had those in many different circumstances over time. And I think that the TTC, as usual, is just doing a very prudent thing and reaching out to some of their retired workers to see if they were available if needed, because what we have an obligation to do as a city is to provide transit service to get people to and from work and school and go about their daily duties. And we have to look for contingency plans to make sure we can do that if we are short people because of the vaccination mandates. But I'm still very hopeful that what we can do, working with our friends in the unions that represent our TTC workers and with the workers themselves who just do such a great job for us, is we can reassure them, inform them, work with them, comfort them, and get them vaccinated so that this becomes kind of an academic question and it just becomes a contingency plan you would expect any responsible organization to have, but it never has to get implemented.
Great, thank you very much. And did the doctor want to weigh in on this, or?
Well, when it comes to worker vaccination, that really does fall more within the realm of occupational health and safety. I can say that over and above the city's responsibilities, which the mayor spoke to around providing a transit service, as I understand it, and again, I'm not an occupational health expert, but employers do have an obligation to ensure a safe workplace for their employees. And one of the ways by which you do that is to ensure that there's a vaccination policy in place, again, to protect people from the negative impact associated with COVID-19. This seems like a very good move from an employer perspective, I would think, in the middle of a global pandemic. And from a public health perspective, we know that the more we have people within our community vaccinated, the safer we all are. And as I spoke to before, we know that there are currently people in our community who are not yet eligible to receive vaccine. That's just an additional reason over and above protecting ourselves as we get vaccinated. The more of us who get vaccinated, the better protected are all those in our community who cannot currently get vaccinated at this point. So I think it's just a good move all around.
Thank you very much.
Okay, that's it for today, everybody. Thank you and have a good week.